New studies reveal that central obesity in childhood is linked to early signs of metabolic issues. Children whose waist-to-height ratio, an indicator of central obesity, increases gradually during their first decade show a higher risk of cardiometabolic and cardiovascular disease, CVD, by age 10. To explore how negative waist-to-height ratio patterns in childhood can predict cardiometabolic and cardiovascular risks by age 10, researchers examined data from 700 children in a cohort study. These children were monitored through 14 regular clinical visits from 1 week old until they turned 10. The researchers evaluated 5 risk factors to create a composite score for predicting cardiometabolic and cardiovascular risk. These factors include HDL cholesterol, known as good cholesterol, triglycerides, blood fats, blood glucose, height-adjusted, blood pressure, and insulin resistance. They identified 3 different waist-to-height ratio groups from birth to age 10. A stable reference group, a high-falling group, and a slow-rising group. The slow-rising group showed higher levels of cardiometabolic risk factors such as systolic blood pressure, C-peptide, HOMA-IR, glycoprotein acetyls, and high-sensitivity C-reactive protein. These children also exhibited lower HDL cholesterol levels, which is an early warning sign for potential heart and metabolic diseases. The findings of this research emphasize that a higher waist-to-height ratio at age 10 is an important clinical marker of cardiometabolic risk in children. From a clinical perspective, healthcare providers should shift their attention from just weight to the waist-to-height ratio to identify children showing early signs of metabolic risk. The waist-to-height ratio serves as a straightforward and effective method for detecting central obesity with cardiometabolic implications in children, especially in low-resource settings. However, since this was an observational study, it does not definitively establish that negative central obesity patterns in childhood lead to increased cardiometabolic risk by age 10. Ongoing research is being conducted.